This is Dr. Steve Weiner from the Aesthetic Clinic in Santa Rosa Beach, Florida. And the procedure we're now viewing is called Ultherapy or Ulthera. And that is a non-invasive skin tightening procedure. What it does is it uses the technology that one would have when you use break up kidney stones with ultrasounds or gallstones with ultrasounds. So it's the destructive part of the ultrasound that we use. And it goes down anywhere from 1.5 millimeters to 4.5 millimeters, depending on which of the heads you use. And so what it does is it makes a lesion underneath the skin at that particular level. And at the deeper level, it's at the level of what we call the SMAS, S-M-A-S, which is the layer of the tissue that you actually tighten when you do a facelift. So essentially what we're trying to do here is a non-invasive facelift. It takes about an hour and 15 minutes to do the entire face. There is some discomfort with this procedure, so as you see, the patient in one hand is holding a fan which is cooling the skin. Sometimes patients will take oral medication as well for this. Afterwards, there's absolutely no pain. There's no downtime with this procedure. You might have some mild bruising. The procedure can be done more than once, and you begin to see the results immediately, but most importantly, the final result takes probably 3 or 4 months to see. Other technologies that have been around for much longer, like Thermage or Firm or Excellus, use a radio frequency. The problem that radio frequency has is it's very inconsistent. You have to heat up the skin to a certain level, and it's very difficult to monitor that using the radio frequency. The Ulthera is much more consistent and will always lay down those lesions, as I said, at those different levels. Ulthera has come a long way in the past 2 years. We've had this procedure for about 2 years, where you used to only do this procedure at one level, and about 1.5 years ago or something, we were doing it at 2 different levels. So that means at 2 different depths, so maybe a 4.5 and a 3.0 millimeter depth. And now they came out with a 1.5 millimeter depth. So some people are actually even getting 3 different treatment levels. So what this can do is it can help make a jawline that is much more defined. It can help eliminate the fine lines and wrinkles around the eyes, around the mouth. It can elevate the brows and give a mild brow lift. And it can help with that turkey neck, making that a little bit smaller. Now, it's not going to give you a surgical lift, but it will improve non-invasively, and I believe better than any other non-invasive procedure, this device. Sandy is a registered nurse, a former critical care nurse, and she's the one that performs these procedures in our office. She has attended 2 of the advanced provider courses that they have in Mesa, Arizona at the company. So, and she actually runs these roundtable discussions about her experience, and they exchange ideas. So we are at the forefront of the technology for Ulthera. Soon, but not just yet, and probably when you view this video it might be out, but we're looking at doing the Ulthera to tighten chest skin, to tighten the skin around the knees, and there even is some research to use this procedure to eliminate the sweat glands underneath the armpits, so that for excessive sweating or people that just want to sweat less, you can do this procedure. It's probably going to take you 2 procedures to do that on the underarms. I wanted to reiterate that when this client is done with this procedure, there's absolutely no downtime. She could put on makeup immediately, she could go out, go to a restaurant. She might have some very mild swelling for a day or 2, but it's not significantly noticeable. And over the last 2 years where this procedure has been performed, there have been no long-term side effects. Like I told you Previously, there are some people that have some mild bruising, particularly ones that are on blood thinners, but it's okay to do on blood thinners. Occasionally, some people have a little bit of numbness in the treated area, but I want to reiterate there have been no long-term side effects from this treatment.